Good evening, class. My name is Devin Phillips. I'll be doing my demonstrative speech on vital signs. So starting off with vital signs, there are two different things that doctors look for when they're giving a diagnosis right off the top. One of them is vital signs, the other one's symptoms. Symptoms are subjective. They're how you feel, where how a patient describes how they feel, where vital signs or signs are objective. So that's something that a doctor can tell that is just straight up fact. I'll start off with the different major arteries that are in the body. Up here you have the carotid, down here you have the brachial, you have the radial, you have the femoral artery, and the top of the foot here you have the dorsalis pedis. When you're taking something like blood pressure, you are looking for the brachial is what you're taking with the stethoscope. You'll be auscultating, which is medical term for listening. So you're listening to the brachial artery to get your blood pressure. Another way you can take a blood pressure is to palpate a blood pressure, which is you just take the top number, the systolic, and once you feel the radial pulse, then you call it there, and that's just your radial pulse for a palpated blood pressure. And that is just more something you're trying to do quick, like trauma or something. Alright, so let's get started. So this is a blood pressure cuff. As you see here, there's the different numbers. And you want to get two numbers when you take a blood pressure. It's your systolic and your diastolic. Your systolic is going to always be the top number, and that is the pressure that is in your arterial wall when your heart constricts. The bottom number, the diastolic pressure, is the pressure that's left in your arterial walls when the heart is relaxed. So like I said earlier, you want to auscultate the brachial pulse, or the brachial artery, excuse me. So first thing you want to do is you can place your stethoscope just over the brachial artery, and then you want to pump up the pressure. Okay, so for my dad here, his blood pressure was 132/72. That was his resting blood pressure, which isn't bad, especially since he's an old man. But you want to look for something by between about 120 for your systolic, 80 for your diastolic. That's kind of the average. If it's a little higher, I want to say 140/100. That's what's called hypertensive. That's where your blood pressure is too high. If you're looking at a blood pressure that's like 100 systolic, with a bottom number of about 50, your diastolic pressure, that's hypotensive. And all of this information can be found through the American Heart Association. I will also be going over other vital signs like pulse. Usually you want to go for the radial pulse if it's just relaxed. And there's three things you want to use when you're getting a pulse. Obviously it's the quantity, the quality, and the strength. So if right now he has a resting heart rate of about 60, regular and strong. So you got your quality, your strength, and your quantity. For most adults, when you want to take a quick heart rate, when you're taking vital signs, you always want to go for the carotid. For children 10 and under, you want to go for the brachial. The reason for this is that when you're younger, the brachial pulse is actually stronger in your arm when you're a kid, and when you're an adult, your strongest artery pulse is in your neck, the carotid artery. Fun little easy way to remember this is that adults drive cars, kids ride bikes. Different pulses can be taken for different situations. Like say you do not have a blood pressure cuff and you want to kind of get the idea of what someone's blood pressure is. You can take dorsalis pedis pulse. That's where if you can feel a pulse pretty easily there, you know that their heart rate, or excuse me, their blood pressure is practically normal. If you weren't able to get one there, or if you're not able to get one at the radial pulse, that's when you know your blood pressure is a little low. I can't remember the rule of thumb off the top of my head right now, but I know that if you can't get a radial pulse, usually that means that your blood pressure is below 100/50, 100/40. Other vital signs that you can use is capillary refill. It's where you squeeze on top here, and that just kind of helps discover a pulse ox. Pulse ox is a measurement of how much oxygen is in your blood. Usually you want to be around 99, 98, 100. If it's delayed, it's more than 3 seconds, and that means that you don't have a lot of oxygen in your blood. Other vital signs we can take are respirations. Once again, you can do this by looking at chest rise and fall. You usually want about 12, 20. You don't want too much breath, obviously, because if you're breathing too fast, you're not getting enough oxygen to your brain. Your heart rate increases. Other vital signs that can be taken, you got your heart rate, you got your respirations, you got your blood pressure. Those are pretty much the basic ones. Usually, obviously, when you go to hospitals, your urgent cares, doctor's offices, they'll take temperature. And if you want temperature, it's usually about 98.7 is normal. So that's a quick little rundown of the different vital signs and how you take them, and the difference between vital signs and what symptoms are. And that's all I got. Thank you.